I'm from New Orleans, Louisiana. Today, my group and I will argue the causes of autism. Many causes of autism have been theorized, but no cause has been definitively identified. Today, we have Susan Curris from Indianapolis, Indiana, that will argue that there is evidence to suggest that there is a relationship between environmental factors and autism. We also have Brittany Williams from Orlando, Florida, that will argue the evidence that suggests genetics play a role in the development of autism. However, I will argue that there is no reliable evidence that childhood vaccination plays a role in the development of autism. Regrettably, the erroneous belief that childhood vaccines cause autism has created public health issues, as many parents have chosen not to vaccinate their children out of fear that they will develop autism. Now, we will hear from Susan that will be arguing the genetic factors.
There are many different environmental factors that have been identified as potential causes for autism spectrum disorders. Hundreds of different factors have been suggested as causing autism, and many of them have already been researched and studied, some more extensively than others. Some of the factors that have been discussed and researched include maternal and paternal age, medications used by the mother during pregnancy, exposure to cigarette smoke, use of illicit drugs, pre-existing medical conditions, and alcohol exposure, environmental toxins such as lead and mercury, and condition at birth, specifically low birth weight and hypoxia. The article Prenatal and Perinatal Risk Factors for Autism cites studies that support advanced maternal and paternal age as being a significant predictor of autism spectrum disorder. 4 studies were conducted regarding paternal age as a risk factor, and in 3 of those studies, paternal age was found to be a factor even after controlling for other variables, such as maternal age. With regard to maternal age, 7 studies were conducted, and in 6 of those studies, advanced maternal age was associated with an increased risk of autism before controlling for other variables, and it remained a factor in 3 studies after controlling for other variables. The main reason that this appears to be the case is that maternal age also causes increased complications during pregnancy. Increased maternal age is known to be a risk factor for gestational diabetes, and although research is limited on this topic, studies that have been completed have shown that being diagnosed with diabetes during pregnancy doubles the chances of the child being autism spectrum disorder. A study conducted by Reichenberg, Gross, and Weber in 2006 found that the risk of being diagnosed with autism spectrum disorder doubled with every 10-year increase in paternal age. One study suggested that this is because mutations are transmitted to children at a much higher rate from the father than from the mother. While there is evidence to support maternal and paternal age as increasing risk factors for autism diagnosis, these increases occur for completely different reasons. Low birth weight and hypoxia have also been identified as risk factors that increase the risk of autism. Low birth weight is generally considered to be a birth weight of 5 pounds, 5 ounces or less. To put that in perspective, the average newborn weighs between 6 and 9 pounds. Although low birth weight is generally associated with other maternal risk factors or medical conditions, this is not always the case. Birth weights vary a great deal from one child to another. Some babies are simply smaller than others, and there are many reasons for why this can occur. Hypoxia is a deficiency in the amount of oxygen that is reaching the tissues in the body, or oxygen deprivation. Low birth weight has been more frequently studied than other factors because it's a measurement that's easily taken and is recorded by hospitals routinely. These 2 factors are also frequently associated with psychological, neurological, and cognitive difficulties that are often found in children who are diagnosed with autism. Some of these conditions include speech and language problems, attention problems, social deficiencies, hyperactivity, and learning disabilities. Substances that have been studied as potential links to autism spectrum disorder. Obviously, the use of cocaine and other illicit substances is extremely dangerous to both the mother and the baby and can cause many health issues and deficits for the child, some of which may not be evident until the child is older. That being said, how the use of these substances during pregnancy affects the risk of being diagnosed. This area in particular is one that has not been studied as extensively yet, and the research that has been conducted has not conclusively shown a link between the use of illegal substances and autism. One of the medication categories that has been studied is selective serotonin reuptake inhibitors, or SSRIs. These are used to treat depression symptoms, and they're commonly considered to be a safer treatment option for pregnant women who suffer from symptoms of depression. Their use have been studied fairly extensively, and the study groups have been fairly large. The result of many of the studies have supported a link between medications and increased instances of autism spectrum disorder. The studies vary pretty widely on the level of risk. For example, some studies have shown that the risk doubles or triples with the use of SSRIs during pregnancy, and other studies focus less on the risk, such as gender of the baby. For example, it occurs more frequently in males, or the trimester in which the exposure occurred, and it was found more common in first trimester exposure.
Thank you, Susan, for discussing the propositional side. Now we will hear from Susan again, arguing the oppositional side.
So although there is some evidence which suggests that some environmental factors are associated with increased risk of autism spectrum disorder, there is not any conclusive evidence that supports a clear link between these factors and autism diagnosis. Therefore, we cannot definitively say at this point that autism is caused by any of these factors. It has been one of the most frequently studied risk factors for autism, and although multiple studies have shown that there is an associated risk, there are many other factors that have to be considered as well. Advanced maternal age increases the risk of many obstetric conditions and complications, and at this time, there is no research that shows that these issues are not contributing to the increased incidence of autism along with the age of the mother. Additionally, the studies that have been conducted in regards to advanced maternal age have not demonstrated a consistent finding that this is in fact a factor which causes autism spectrum disorders. In many other conditions and disorders, low birth weight has not been studied enough, and the studies that have been completed, again, have not shown consistent data that supports low birth weight as a factor in autism spectrum diagnosis. Although there is a significant amount of research available that links the use of SSRIs during pregnancy to increased rates of autism, it has not been established as a definitive cause or even as an absolute link to a diagnosis of autism. In the article, Prenatal Factors Associated with Autism Spectrum Disorder, it states that between 9 and 14% of pregnant women experience at least one symptom of depression during their pregnancy. Can cause negative effects on both the mother and the unborn child. So at this point, it's impossible to say whether the increased rate of autism is directly linked to the medication or if it's due to the depression itself or to other factors. The amount of research that has been conducted into these factors and their potential links to autism is somewhat limited, with some factors being studied more frequently than others. Although there is evidence linking some environmental factors to increased instances of autism, there's still a lot of research that needs to be completed before a positive correlation between these factors can be made, and we're able to definitely say that autism is caused by one or a combination of these factors.
Thank you, Susan. Now we will hear from Brittany, who will argue genetic factors.
Hi. So current research tells us that autism spectrum disorder is a multifactorial and includes genetic and environmental factors. So with this evidence, I would have to say that genetics plays a part in the cause of autism. Most scientists have said and agreed that genetics are one of the risk factors that can be the cause of autism spectrum disorder. Genetic factors may be one of the most significant causes for autism because early studies of twins have estimated hereditability to be over 90%, meaning that genetics explain over 90% of whether a child will develop autism spectrum disorder or not. A common hypothesis that I have seen within many of my research articles is that autism spectrum disorder is caused by the interaction of a genetic predisposition and an early environmental insult. Several theories based on environmental factors have been proposed to address the remaining risk. In the article Autism Spectrum Disorder and Epigenetics, there is evidence that suggests that the epigenetics play a role in autism spectrum disorder etiology and that it may combine genetic and environmental influence together and dysregulate the neurodevelopmental process. So, the research in this article shows us that epigenetic modifications can alter the gene expression in someone without altering their primary DNA. This alone can play a significant role in the etiology of autism spectrum disorder. Epigenetic mechanisms may increase the risk of autism spectrum disorder. Epigenetic changes occur as a result to not the DNA sequence changes, but the chromosomal histone modification or the modification of the DNA bases. Prenatal environment is another big risk when looking at autism spectrum disorder because several prenatal risk factors like advanced age in their parents, diabetes, bleeding, and the use of psychiatric drugs in the mother during pregnancy. There is also an infectious process where the prenatal viral infections have been called the principal non-genetic cause of autism spectrum disorder. Prenatal exposure to the rubella or the cytomel activates the mother's immune response and greatly increases the risk for autism spectrum disorder. Teratogens are genetic agents and that cause birth defects. Some agents that are theorized to cause birth defects, too, have also been suggested as potential autism spectrum disorder causes. Thyroid problem. Oh, I wasn't done. Sorry. I added so much more. Sorry. Thyroid problems that lead to thyroxine deficiency in the mother in weeks 8 to 12 of pregnancy have been postulated to produce changes in the fetal brain leading to autism spectrum disorder. Thyroxine deficiencies can be caused by inadequate iodine diet and by environmental agents that interfere with the iodine uptake or act against thyroid hormones. Diabetes in the mother during pregnancy is another significant risk for autism spectrum disorder. A 2009 meta-analysis found that gestational diabetes was associated with twofold increased risk. According to the Autism Society, autism tends to occur more frequently than expected among individuals who have other medical conditions, which would include Fragile X syndrome, tuberculosis, congenital rubella syndrome, and untreated PKU. In the article, Autism Spectrum Disorders and Epigenetics, they add the medical condition called CHARGE. CHARGE stands for columba of the eye, heart defects, artesia of the nasal coronae, retardation of the growth and or development, genital and or urinary abnormalities, and ear abnormalities and deafness. These conditions listed show a dysregulation of epigenetic marks too. Researchers also believe that autism spectrum disorder falls on the list of genetic influences on cognitive development. Other disorders that fall on this list because of the genetic influences of the cognitive development are Down syndrome and dyslexia, which both of these are chromosomal disorders. The locus coeruleus system theory hypothesizes that autistic behaviors depend at least in part of a developmental dysregulation that results in impaired function of the locus coeruleus system. Okay.
Thank you for arguing your position, Brittany. You made some good points about why genetics may cause autism. We will now hear from Brittany again on the oppositional side of this argument.
Okay. So there are only a few studies that want to say that autism can happen genetically and can be passed down, but this is a fairly new study. I do not believe that we can say that autism is genetically passed down with very little evidence. According to Autism Speaks, there is no one cause for autism. We cannot say that autism comes directly from genetics or even directly from one's environment. Yes, changes in genes will increase the risk that a child will have autism spectrum disorder. A child has a good chance of having autism spectrum disorder if a parent carries the gene, but a child still has a chance of developing autism spectrum disorder even if the parents do not carry a gene. Changes of a gene does not cause autism alone. Yes, they increase the risk for the disorder, but they have other factors that contribute. According to the Autism Society, some contributors could be Harmful substances ingested during pregnancy, meaning that not only is it genetics, there are a lot of other things that can contribute to the risk factors of developing autism spectrum disorder. It is very important that we remember the definition of cause and the definition of risk, because they are not the same. A risk means that it heightens the odds, but does not cause it. A cause is when something comes directly from that. And we cannot specifically say that genetics is the cause. It is only a risk factor as of now. Thank you.
Thank you, Brittany. Next, we're going to hear from Kristen, myself, answering or arguing the question, do vaccines cause autism? I'll first start with the propositional side of the argument. In 1998, the gastroenterologist and medical researcher Andrew Wakefield conducted a study titled Ileal Lymphoid Nodular Hyperplasia, Nonspecific Colitis and Pervasive Developmental Disorder in Children. It was published in the English journal The Lancet. It suggested that the MMR vaccine, which stands for measles, mumps, and rubella, causes pervasive developmental disorder and regression in behavior. In the early 2000s, celebrity Jenny McCarthy spoke out against vaccines, stating that her son's autism was potentially caused by vaccines. Other celebrities followed in her footsteps, speaking out about government-mandated vaccines. This drew more attention to the theory. In a study conducted in 2011, researchers Satyanarayana Rao and Andreas state that Wakefield's study is responsible for individuals believing that autism was caused by vaccines. They also state that parents across the globe stopped giving their children vaccines in fear of their children getting autism. Parents have reported that after their child received vaccines, that they noticed a regression in behavior. Rates of autism and rates of childhood vaccination have both increased in recent decades. Some say that this is no coincidence. The term anti-vaxxer is used for individuals against government-mandated vaccines. Now I'll be moving on to the oppositional side of this argument. In 2010, The Lancet redacted Andrew Wakefield's 1998 study, Ileal Lymphoid Nodular Hyperplasia, Nonspecific Colitis, and Pervasive Developmental Disorder in Children. A representative for Centers for Disease Control and Prevention said the redaction, quote unquote, builds on the overwhelming body of research by the world's leading scientists that concludes there is no link between MMR vaccine and autism. Numerous population-based studies have provided additional strong evidence that vaccines do not cause autism. A 2002 retrospective cohort study titled A Population-Based Study of Measles, Mumps, and Rubella Vaccination and Autism that was published in the New England Journal of Medicine found no relationship between MMR vaccine status and autism. The cohort included all 537,303 children born in Denmark from January 1991 to December 1998. A 2005 study titled No Effect of MMR Withdrawal on the Incidence of Autism, a total population study that was published in the Journal of Child Psychology and Psychiatry, found that MMR vaccine is highly unlikely to be a main cause of ASD and that it cannot explain the rise in the incidence of ASD. It also concluded that reducing the use of MMR vaccines cannot be expected to reduce or lead to a reduction of ASD. Now I'm going to talk about the pervasive belief that vaccines cause autism and its positive and negative impacts it has had on society and overall health. The positive side is that evidence demonstrating genetic and environmental causes of autism may convince more people that childhood vaccines are safe and do not cause autism. This, in turn, may inspire more people to vaccinate their children, which is good for both individual and public health safety. Since the introduction of childhood vaccinations for measles and tetanus, there has been a significant decrease in childhood mortalities. The positive impact. Now we will discuss the positive impacts environmental factors have on the cause of autism. The positive impact that the potential environmental factors causing autism is that it causes many individuals to be more cautious about what they put into their bodies and what factors they expose themselves to, particularly during pregnancy. Although the link between autism and environmental factors remains unclear, health risk associated with many of these factors, such as exposure to lead, use of illegal substances, cigarette smoke, and side effects of many medications. Being aware of and cautious of the risk associated with these environmental factors will have an overall positive impact on the general health and well-being of society. Now I'm going to discuss some of the negative impacts the negative impacts that vaccines cause autism has on society and overall health, as well as environmental factors. Individuals are vaccinating their children less. Measles was declared eradicated from the United States in 2000. According to the Center for Disease Control and Prevention, there were 667 cases in 2014 and 189 cases in 2005. A review of 18 measles studies and 32 pertussis studies published in the Journal of the American Medical Association found that unvaccinated children contribute to disease outbreaks. Parents that make the decision to refuse or delay vaccines were proven to be at a higher risk of vaccine-preventable diseases for their children and for the community in which they lived. A study conducted by Aileen Wang et al. Stated that vaccine exemptions are typically found in geographic clusters, making certain communities more prone to outbreaks than others. In 2015, the Center for Disease Control reported a potential measles outbreak at a Disneyland theme park in California. This outbreak was said to be responsible for over 100 cases of measles. An unvaccinated 11-year-old boy is said to have been responsible for the outbreak. Now I'm going to talk about environmental factors. There is unfortunately a negative impact on society associated with environmental risk factors. This can go one of two ways. For some, because the connection between autism diagnosis and environmental factors is not confirmed, they may be overly cautious about exposure to these factors. While this is not a negative thing on its own, I think that it increases the potential of people making assumptions about the causes of autism and the potential for misinformation to be communicated throughout the general public. On the other hand, because there's no definite link between autism and environmental factors, some people may not be cautious about their exposure to or use of these factors. This may result in increased health risk and safety concerns, not only to that individual, but also to members of the general public who may come into contact with that person. Next, we will have Susan and Brittany discussing ethical responsibilities as a BCBA.
The ethical responsibility. Am I done?
Who wants to go? Who wants to do this one?
I'll do it. Okay. The ethical responsibilities. Okay, guys, sorry.
No, you're fine. We didn't talk about it. It's fine.
So I'm going to do the first part?
Huh? Yeah, you and Brittany can just like split it up. I mean, your name's Brittany. You and Claire.
Okay. The ethical responsibility that a behavior analysis has to a client with autism spectrum disorder is to make sure that they operate in between the lines of the code of ethics. They must respect and interact with their clients and make sure that they are giving the best treatment and treatment plans available to the client. In section 2.0 of the ethical code, it says that behavior analysts must operate in the best interest of their client. Quote, behavior analysts have a responsibility to operate in the best interest of the clients. The term client, as used here, is broadly applicable to whomever the behavior analyst provides the service, whether an individual person, service recipient, a parent or guardian of the service recipient, or an organization representative, a public or private organization, a firm, or a corporation.
Another aspect of the ethical responsibility of behavior analysts is covered under Section 1 of the Code of Ethics. Section 1.01 states behavior analysts rely on professionally derived knowledge based on science and behavior analysis when making scientific or professional judgments in human service provision or when engaging in scholarly or professional endeavors. Section 1.02 states, all behavior analysts provide services, teach, and conduct research only within the boundaries of their competence, commensurate with their education, training, and supervised experience. This means that as behavior analysts, we should be utilizing information that is scientifically sound and has been researched thoroughly in our practice. In addition, our responsibility to the profession as well as to our clients and their families is that we are practicing within our scope of expertise and competence. In this specific situation, that would mean that as behavior analysts, we're not qualified to make diagnosis or assumptions about why a child has autism spectrum disorder. Further, we should be careful not to give clients or families information or the perception that a diagnosis of autism was caused by a specific factor or characteristic.
Now we will go to Brittany, who will answer some questions.
Okay, so my first question is there no specific cause of autism? At this moment, there is no actual specific cause that researchers have found that cause autism spectrum disorder. There are many risk factors that researchers believe contribute to having autism spectrum disorder, though. Question 2. What is the difference between something causing autism and something contributing to it? When something contributes to something, it means that this could be a reason, but it also could not be the reason. So, for example, if mother number 1 does not take prenatal pills during her pregnancy, but mother number 2 does, but they both have children with autism spectrum disorder, it could be a factor, but it also could be something else. Question 3. Does anyone know if there will ever be if they will ever find a real cure? We really hope that eventually scientists or researchers are able to get to the root cause of autism spectrum disorder, but at the moment, we do not know what will happen. What we do know is that people with autism spectrum disorder are not very different from anyone else in the world and should not be mistreated or treated any different. If a parent or a client asks you as a BCBA what the cause of autism or if their child will ever be normal, what would you tell them? I would tell the parents that their child is not unnormal because he or she has autism spectrum disorder, but that they are like every other human being in the world. They just learn differently. I would tell them that we do not know what the cause of autism spectrum disorder is, but instead they should focus on how to understand their child and how to help them. Thank you.
All right, and that wraps up our debate. Thank you so much. Bye.